I'm fine, thank you. How are you?
My research is on primary healthcare in Africa. I'm working on two projects. The first one is called Huraprim, which is about human resources for primary care in Africa. One of the main things we're doing in that project is a confidential inquiry on maternal and child deaths to try and find out why mothers and children are dying of common preventable illnesses. The second project is called MUTI, which stands for Multidisciplinary University Traditional Health Initiative, and it's a project on traditional medicine in Africa. We're looking to support African universities to do good quality research on traditional herbal medicines, which hopefully can be developed into new medicines. The Department of Primary Care Health Sciences has been very involved in the confidential inquiry on child deaths in the UK. This has been a study to try and find out what avoidable factors there might have been in children who died. We're looking to try and adapt this method to the context in Africa, particularly in Mali and in Uganda, to try and understand what avoidable factors exist in their health systems and how those could be remedied to try and prevent some of those deaths. Every year, about 10 million children die before their 5th birthday. In Uganda, that's about 1 in 5 children will not make it to the age of 5. And as the average family size is 6 children, that means almost every family will lose at least one of their children. We have a team of field workers who go to interview the families of the patients who have passed away to try and find out exactly what happened. We also interview any health workers who are involved, or at least we invite them to be interviewed. They don't all agree. And all of the information from that and from any medical records is put together into a summary. We feel that looking at particular case studies is a much more powerful way of convincing people to improve the system than just talking about statistics. Because these are cases that people have been involved in themselves. They often recognise the cases and they're real to them. And hearing the story of someone who's died is probably a greater motivator for change than just hearing about numbers of children who haven't got a mosquito net or haven't been vaccinated. The reactions we've had have been, on the whole, very positive. Particularly the local politicians are very interested in the recommendations. If there's one thing politicians understand, it's death. And in fact, the local district chairman has asked us to expand the confidential inquiry to the entire district, which we don't have the resources to do, but we are planning to scale it up to several other areas. Of course, there's a long way to go, but there are some moves in the right direction, which is very encouraging.